All right, everybody, we are going to go ahead and move on to our week 2 lecture here. I just wanted to remind you that in addition to these recorded lectures, you're also responsible for your week 2 textbook activities. So we have a little video here about all of our body systems. And then make sure you look at all of your drop downs. And I want to highlight one right here that I know is on your upcoming Unit 1 test. Look at the levels of organization. So when we say levels of organization, what we're talking about is going from our building blocks or our smallest to our whole system. So level 1 here, molecules. These are our building blocks of all body structures. Molecules come together to form cells, which is our smallest functioning unit of living organisms. So even though this is level 2, this is our first level where we can actually have something that is living. If we have like cells, we form a tissue. So these are groups of cells working together to perform a specific function. When we have multiple different tissues that are grouping together to perform a specific function, we call that an organ. Moving on up are groups of organs that work together to perform major functions and meet our physiological needs of the body. So an example of this would be our digestive system. So it's not just one organ that makes up our digestive system. There's multiple organs, but they're all working towards the common goal of uptaking nutrients and energy and getting rid of waste. And then finally, it's our whole body, the entire organism. If we put all of our organ systems together, then we can function as a human. So we're going from smallest or our building blocks down here in level 1 all the way up to a level 6 organism. And you can see the theme is kind of that when everything in level 1 comes together, we get level 2. When level 2 comes together and we get multiple cells, we get a tissue. So they continue to build on one another. Okay, let's pop back over to Canva. We're going to talk a little bit more about body organization. So I have another case study for you. This is a good time to go ahead and pause the video and go ahead and try to identify all the different medical terms, just like we did last week. And I'll give you about 2 minutes to do that. So pause, set a timer for yourself, see how many you can identify quickly. Okay, I'm going to go ahead and read this out loud so that we're all on the same page with pronunciation. A 23-year-old carpenter presented following an accident in which a nail gun had been fired 1 meter away from him and a nail had penetrated his left chest. Apart from pain, he had no other symptoms, and the only sign was a 2-millimeter long wound, 4 centimeters medial to his left nipple. All observations were stable. Posterior, anterior, and lateral chest radiographs showed a 3-centimeter nail entering the cardiac shadow. A CT scan showed penetration of the left ventricle, and echocardiography showed a mild effusion with no intracardiac damage. Median sternotomy was performed, and an apical laceration was repaired. On opening the left pleura, the nail was visible, its head lodged in the costal cartilage. The patient was discharged after 4 days. Penetrating cardiac nail gun injury has a reported mortality of 25%, but fortunately our patient remained stable throughout. So take a look at all the stuff underlined here, see if there was anything that you missed, or maybe anything that you found that I did not. I see at least one we could put cardiac here, would count as a term. All right, another good test is now look at the ones that you underlined and make sure that you can know what they mean. And even better, if you can try to break them into their prefixes, combining forms, combining vowels and suffixes, that would be some great practice for your upcoming test. Okay, so I'll help you define them. So our abbreviation SX is for symptoms, echocardiography. So echo meaning sound or ultrasound in many cases, cardi being our root for heart, and graphy being our root for imaging or a record. Radiograph, so this is again, graph is that record, or in most cases it means an image. And then we are going to use radiation to do so. So radiograph is an X-ray. Cardiac, you can break into the root cardi and the suffix "ac". Remember, no combining vowel because our suffix is starting with a vowel already. So when we're defining cardiac, we're going to start with our suffix, meaning pertaining to, and then we know our root cardi is for the heart. A CT is a computed tomography scan, so it's a super fancy X-ray. It gets some cross-sectional imaging of the body. So we get transverse slices, and so we'll circle back to that when we talk about our body planes at the end of this lecture. Now, CT scans are kind of like I said, fancy X-rays, but they can also see soft tissue a little bit more. And so what I mean by that is when you get an X-ray, it's typically going to be focusing on bone. You really can't see stuff like your lungs and heart and other organs. It's just going to be bone, or if you have some kind of hardware or metal or something like that will be shown too. Now, a CT scan is really good at showing bone too, but it can also show some of those other structures like your organs and muscles and that kind of stuff. Okay, intracardiac. So intra is within, that's our prefix. Cardi again is our root, and ac. So we're just adding intra on top of cardiac. So now we're pertaining to within the heart, not just pertaining to the heart. We're being a little bit more specific. Sternotomy. So you start with your word root tomi, or sorry, not word root, I misspoke. Suffix tomi means cutting into, and then you have stern is your sternum, and O is our combining vowel. Then we have pleura, which means the pleural cavity. Okay, we're going to do a quick highlight of organs and organ systems. So I don't expect you to know these organ systems in and out, or every organ that's a part of these organ systems. That is not necessary. We are just going to highlight some of the major functions, and your textbook reading within D2L also highlights this. Okay, the first one we're going to mention is the integumentary system. This is our hair, skin, nails, and its two big jobs are protection and sensation. So we're trying to keep stuff out that shouldn't get in, and we're sending our brain a lot of signals from our external environment via our integumentary system. Our muscular system, this one's pretty obvious. It helps us move, but something that's not quite as obvious is temperature regulation. So think about when you get super cold and you start to shiver or your jaw chatters, that's your muscular system trying to do some work to heat you up. The cardiovascular system, this is going to be our heart and blood vessels. And so, of course, its big job is to deliver oxygen to all of our body cells, not just oxygen, but other nutrients and materials like glucose and different electrolytes. And our cardiovascular system also plays a large role in equalizing our temperature. The skeletal system, this is all of our cartilage and bones and joints. So primarily it's a support system, it's our structure, but it also gives us protection in the fact that our bones protect some of our major organs. There's a reason you have a rib cage all around your heart and lungs and major organs, because we need to protect those. The lymphatic system, if you kind of look here, you see this map looks pretty similar to the cardiovascular system. So the lymphatic system is almost an extension off of that. It helps return fluid to the blood, but it really is important in our immune function. So some organs or parts that make up the lymphatic system, we have our thymus, your lymph nodes and lymph vessels, as well as your spleen. Like I said, don't worry too much about anything in depth on this stuff. Just get the big ones. So immune function and returning fluid to the blood are the two big ones for the lymphatic system. Our respiratory system. So not only does this just include our lungs, but also our nasal passages, our larynx, and our trachea, which some of you may have known called your windpipe. You have your bronchi, and then alveoli are little tiny sacs in your lung where the gas exchange or oxygen carbon dioxide exchange actually occurs. Our nervous system, so our brain, our spinal cord, and then all the nerves that branch off of our spinal cord and spread everywhere in our body. So, of course, this is not only sensation and sensory information, but this is how we're going to tell our bodies to move as well. Our digestive system, so we go all the way from the mouth to the anus to extract our nutrients and eventually eliminate waste. Our urinary system, this begins with our kidneys. Our ureters spread down to our urinary bladder. Of course, this helps us remove waste as well, but it's also super important in balancing our body fluids and in the different concentrations of materials within the blood. Our endocrine system, the big thing you should think with the endocrine system is hormones. So this is going to regulate a lot of our body's processes by secreting hormones. So our nervous system and our endocrine system are our two major signaling systems, or how we tell our body what to do and how our body gets information. So this includes the pituitary gland. Your thyroid is one that many of you may have heard of. Your pancreas, your adrenal glands, they of course secrete adrenaline. And then the ovaries and the testes would also be included in our endocrine system. So that's one other good point, that we can see some overlap in some of these systems. So the ovaries and testes are a good example. They are considered part of the endocrine system, but they would also be considered, of course, part of our reproductive systems. So there are a few organs that fall into multiple systems because they have multiple jobs. So the female reproductive system, this includes the mammary glands, the ovaries, your uterus, of course. Both reproductive systems' jobs are to produce their sex hormones and gametes, meaning immature sex cells. And then in the female reproductive system, it also has to have the capability of supporting and growing the fetus and neonate. Okay, our directional terminology, we talked about this a little bit already, but let's do a bit of a refresher. So remember, superior and inferior is top to bottom. Same thing with cranial and caudal. So we're talking from the head to the tail. Anterior is the front, posterior is the back. Ventral is another word for anterior or the belly side. Dorsal for posterior or the back side. Now, one that's not on here that I'll highlight real quick would be superficial and deep. It's not on the actual diagram. So our skin is superficial to our bones. So our skin is closer to the surface than if we were going to go into our ribs and the bones. So at the same time, we can also say our skin is superficial to our vertebrae. So it's not the same as anterior, posterior. You're talking about closer to the surface and then deeper within the body. Okay, medial is right down the midline. Lateral is away from the midline. So remember our example before was the umbilicus is lateral to the hip. So not to get confused with superior and inferior is proximal and distal. So proximal meaning closer to the attachment point, distal meaning farther away from the attachment point. So you see the shoulder is proximal to the hand. This can apply to the leg as well. the hip is proximal to the ankle, or vice versa, the ankle is distal to the hip. Okay, these are a few of the directional terms that showed up in our case study today. So take a quick second and define these. Okay, lateral, we're going to the side of the body. Medial is going to be towards the midline. And then posterior or anterior, this is something that you really will only see in pertaining to imaging. This is not something that you would typically see it referring to a region of the body or anything like that. So this just means that the imaging was shot back to front, or you view it back to front. And remember, this is a transverse slice of the body. Definitely make sure you review your directional terms. That is something else that will show up on the exam. I would definitely, you're going to focus your studying on your words, but it is going to show up. All right, we're going to switch it up a little bit and talk about the body planes, the body cavities, and the body regions. Okay, we have our cranial cavity. Our cranial cavity is going to be what contains our brain, and we have our vertebral cavity, which is what contains our spinal cord. So both of these are the two cavities of our dorsal cavity. So the dorsal cavity, or that posterior cavity, is made up of the cranial cavity and the vertebral cavity. We have our ventral cavity that's a bit more complex. So we break our ventral cavity into the abdominopelvic cavity and the thoracic cavity. So our dividing line for our ventral cavity is our diaphragm. Let me go. No. I just wanted to make sure I didn't have a zoomed in picture for you guys. Okay, so our diaphragm is our dividing line in the abdominopelvic and thoracic cavities, or our ventral cavity. So you have your superior mediastinum and our inferior mediastinum, or the pericardial cavity. This is where your heart is. You have your pleural cavity on the left and the right. So that's where our right and left lungs are. You can see here that the left one's a bit smaller because it's got space for our heart. We have our abdominal cavity and our pelvic cavity. So the ventral cavity breaks down a bit more. So you have ventral is this whole front cavity. We break our ventral cavity into the thoracic cavity and abdominopelvic cavity. And then we break our abdominopelvic cavity into abdominal and pelvic. So our abdominal cavity is where a lot of our digestive organs are: our heart, our liver, our spleen, our kidneys, our intestines, pretty much everything else except for your heart and lungs. One other thing I want to talk about real quick in the dorsal body cavity is the vertebral cavity is where your spinal cord is. And then, of course, the bones of your spine form or have a foramen or a hole that this vertebral cavity in our spinal cord can pass through. So let's just talk really quickly about the different regions of our spine. So our neck is our cervical region. We have 8 cervical vertebrae. Sorry, we have 7 cervical vertebrae. We have 8 cervical nerves, but we have 7 cervical vertebrae. The biggest section is your thoracic spine. We have 12 vertebrae in our thoracic spine. So the vertebrae are just each individual one here. So each little one here is a vertebrae, and they're separated by discs. Our low back is our lumbar spine. And then all the way at the bottom, we have our sacrum and our coccyx, which is your tailbone. So your spine's broken down into cervical, thoracic, lumbar, and sacral. And then at the very bottom, you have your coccyx. Right, the other thing we can see on this slide here is our body planes. So we'll start with a mid-sagittal plane. So a mid-sagittal plane is one that kind of runs vertically here, directly down the midline of the body. So if I drew that over here instead, then it would just be a sagittal plane, not a mid-sagittal plane. So think sagittal is side to side. So we have right and left halves with a sagittal plane. Our frontal plane is this orangish color running straight down. And so that one divides the body into front and back. So front and back are anterior and posterior sections with a frontal plane. And then lastly, we have our transverse plane. So T for transverse, top and bottom, or superior and inferior. And so our transverse plane, that was what our CT images were. So it's like taking slices through the body going from bottom to top. So mid-sagittal is only when it's directly down the midline. Our sagittal planes give us right and left. Our frontal plane gives us front and back. And then our transverse plane is going to be top and bottom. Okay, so our abdominopelvic regions and our abdominopelvic quadrants. So remember, it shows this dotted line as our diaphragm. That is our dividing line between our thoracic cavity and our abdominopelvic cavity. So there's two different ways that we discuss these, regions and quadrants. In terms of in the medical field, I would say quadrants are used much more frequently when we are communicating about the abdominopelvic cavity, partly because if you look at our regions, you see how much overlap there is in organs. It's a little too specific in terms of identifying what we want to identify. So one example of this is appendicitis is associated with right quadrant tenderness. So if you're a nurse or if you're a PT and you're doing an evaluation on someone who's complaining about pain in their stomach, if you push on their right upper quadrant and they're like, "Ooh, yeah, that hurts," then you report that as right upper quadrant tenderness. And there's different injuries and pathologies associated with tenderness in the different quadrants. Like I said, our regions are a bit more specific. You do need to be able to label these. You should be able, if you see a diagram just like this with our 9 boxes or our 4 boxes, you should know what the names of the different regions and quadrants are. On your test, you'll kind of see them just labeled with letters, and it may ask you what region is letter C. So you should know these two charts. Okay, this is just an opportunity for a little bit more practice. So try to use your directional terms, your body cavities, and your regions and quadrants. So use the cavities and regions and quadrants as your reference points and compare them using your directional terms. See if you can try to get one for each pair or at least 3. So go ahead, if you want to do that now, take a pause and then start again when you're ready. All right, I will give you guys just one example. So you could say that the epigastric region is superior to our hypogastric region. Or you can even say our left pleural cavity is lateral to our pericardial cavity. So Any ones that you guys came up with could be correct. There's no specific right answers for this one. Okay, let's talk about pathology for a second. So some different terms that you'll see associated with pathology are going to be your signs. These are going to be objective and observable. So these are going to be actual kind of data and numbers based on what's going on with your patient. Your symptoms are going to be subjective and reported. So if they're saying, yeah, my nose has been runny, that could be a symptom. If you see that their nose is running, that's going to be a sign. So objective and observable, what's happening right in front of you versus what the patient is saying to you. So signs and symptoms are slightly different. Our clinical findings, those are going to be results of tests. So like a urinalysis or a CBC panel, a blood draw, that kind of stuff. So let's take a second. Let's try to identify which terms are associated with pathology. So try to find signs, symptoms, or anything to do with a clinical test. Once again, you can go ahead and pause, take your time with that, and then start again when you're ready. So someone that I highlighted here, there was no other symptoms. The only sign was a 2 millimeter long wound, 4 centimeters medial to the left nipple. So he didn't say he had any symptoms apart from pain. And our wound is a sign because we're observing that. That's objective. So radiograph showed, so that's going to be kind of considered a clinical test as a radiograph. The CT scan, same thing. It's an imaging. It's one of our clinical tests. And then echocardiography is also going to be a clinical test. So an electrocardiogram is going to be the electrical activity of the heart, where they hook up the leads to your chest if anyone's had that done to them. An echocardiogram is going to be, remember, echo is sound. They're going to do an ultrasound of your heart to watch it beating. Oh, I missed one here. Okay. So now is a good time to talk about what you should practice for our Unit 1 test. Pause that, it's driving me nuts. Okay, so there is a separate lecture in D2L. There's not a voice recording to go along with it, but it's labeled as your Unit 1 review. So it has a few different activities to help you practice and see where you're at for this upcoming exam. So the exam will be open starting on the 3rd of September, and it will spread all the way to the end of this Sunday, or no, Sunday the 8th is when it is due. So please make sure that you go through all your practice before you take the exam. Remember, make sure you have to have Respondus set up. And so on the Unit 1 review, that's a good gauge. A majority of your exam is on your vocab. So make sure that that is your focus with studying. You really need to know that Unit 1 vocabulary sheet. You should know all the terms on there. But of course, like I mentioned, you should know your directional terms, our level 1 through 6 in terms of our molecule, all the way up to organism that we talked about at the start of this recorded lecture. Know your planes of the body, be able to label those, know your abdominal region. So that stuff will show up, but definitely a majority of questions are going to be directly related to our vocab as well. All right, guys, have a great rest of your day.